Good afternoon, everybody. This is Mike Quaranta with the Delaware State Chamber of Commerce. Thanks for joining our webinar this afternoon, Healthcare Decisions in the Wake of COVID-19. We've got a really terrific panel, and let's get right to it. I want to introduce to you all of our different speakers very briefly. But before I do that, let me just give you a quick commercial message on some other things that are coming up here with the State Chamber. We've got our Developing Delaware conference coming up on October 14th, and we're going to be looking at data, the use of data analytics, how it makes businesses smarter, helps them make smarter decisions, and some key insights that might be in front of them but maybe are hidden. We'll also hear from the CEO of Brookfield Properties about the future of retail. Brookfield owns Christiana Mall and about 20% of the malls around the country. So I'm very excited to hear what the CEO has to say. And of course, we'll hear from Governor Carney again and a couple of other speakers. It would be a really great event. And then we have our Government Affairs Conference later in the month, and Superstars in Business coming up in early November. So if you go to dscc.com, you can get all the details about all of those different upcoming events. And please join the conversation and be part of all that we're doing here at the Chamber. So today, again, healthcare decisions in the wake of COVID-19. Let me introduce our speaker. So we've got Damien DeStefano. Damien joins us again. He's the director of the Delaware Division of Small Business. On normal days, he's very busy. Today in particular, he's going to be super busy because they opened up round 2 of funding for small businesses. We'll hear from Damien first, and then we'll pivot to Nick Moriello, who's president of Highmark, Blue Cross Blue Shield of Delaware. I can say unequivocally that there are a few people in this state. I can't even name, frankly, anyone else who knows more about health insurance than Nick. He's a great asset to the state and to the Chamber, and so we're excited to have Nick. And Lou Memolo. Louis is with Weiner Benefits. Louis has been a very active Chamber member. They have insight into a whole range of different options and plans and programs as a broker, and health is one of the several things that they do, and we'll be excited to hear from Louis in terms of what his thoughts are about other kinds of products that are out there in the marketplace that business people can take advantage of. So with that, let me pause, let me get out of the way and ask Damien DeStefano to lead us off. Damien?
Great, thanks, Mike. Glad to be here today. So we were just going to talk briefly about the DE relief grants. Important to note here, DE relief grants can't be used for health insurance expenses, employee expenses related to health insurance. If we could just go back a couple slides, but they could be used for a wide variety of other business expenses. So if you haven't taken advantage of a DE relief grant, we want to make sure you know as some of those health insurance expenses are coming up, you want to be able to cover your other expenses like a rent payment or a liability insurance payment with the relief grant. If you're in a retail sector, hospitality sector, cosmetology sector, the relief grants can cover your rent payments in the normal course of business from April 1st of this year all the way through the end of the year, December 31st. So you want to be sure you're taking advantage of that. We've definitely had high demand. If we go to the next slide here, we can see that in round 1, which was open in early September, we had over 1,600 people apply for $54 million in funding. And if we go to the next slide, we can just see a quick breakdown of where that funding was distributed, where those applications came from. We had high volume from what we consider very small businesses, under $250,000 of annual revenue. About 3/4 of the applications came from businesses with under $1 million of annual revenue. So we talked to some businesses. The reason I like to present this slide when we talk about the first round of the relief grants is we talked to some businesses and they just said, you know, I wasn't able to access PPP, or I really haven't been able to access grant opportunities in the past. They just haven't really fit my type of business. I'm too small. They're not designed for me. We're seeing quite the opposite with the relief grants. We're seeing a lot of small businesses. This isn't the awards, So we just announced the awards yesterday, and we still saw a lot of those really small businesses getting awarded funding. We awarded about 700 plus businesses with a grant out of the original applicant pool. We are seeing also, if you do the math, 700 is obviously much smaller than 1,600, and the amount of grant awards that went out, 25 million, is more than half lower than the amount of applications that came in. In large part, that's because the information we were getting from the initial round of applicants wasn't what we needed to analyze the grants fully. So we've been working with those in the business community to make sure they have the information they need to apply this time. If you're on here and this is the first time you've heard about these, or you haven't seen some of the follow-up webinars about the things that we are seeing folks miss in the application, just go to our website, delbiz.com/relief. All the resources are there. There's videos, there's documents that'll break down exactly what we're looking for. And then head over to the website portal. It is live right now. We are receiving applications for the second round as we speak. It went live 10 a.m. this morning. We've gotten about 600 applications this morning for the next round. Folks who got rejected in the first round are coming back around, getting the feedback they needed to get their application in proper order. So we're excited to see that next round. We're also launching in this round for questions a hotline. So if you're applying and you want to see, you have a question while you're filling out the application, just head over there. You'll get to speak with a member of our business manager team who will get the information you need to fill out an application. So encourage you to do that. Again, for many businesses, it can cover rent payments. For all businesses, it can cover some of these added expenses that you're seeing during COVID. For instance, purchasing PPE or purchasing an air filtration system or redoing your website. All of those things can be covered through the grant. And I see a question about the hotline number. I have to look it up here real quick. I don't have it memorized, but yeah, so the hotline is 302-672-6816. So if you're filling it out today, tomorrow, it will be open through the weekend, the portal. So you don't have a chance today or tomorrow. You could get on there this weekend and fill it out. We're hoping to keep it open all of next week as well, but at a minimum, it'll be open through this weekend. So that's the breakdown from round one and the information about round two. If we go to the next slide, there's just one additional breakdown, and this is the industries we're seeing it coming from. We know that the interesting thing I think about the downturn related with COVID was it hit businesses across the board, and that's why any business is eligible for this opportunity as long as they're seeing a decline in revenue this year. But it was so acutely concentrated in particular industries, unlike, I think, recessions of the past. And those were our restaurants and bars, hospitality businesses, retail, personal care services, cosmetology type businesses. And so we wanted to focus the grant resources, at least in the initial launch, because of how dire some of the cash flow needs are there, on those types of businesses. And in the first round, we did hit them. If you're in one of those industries, there's plenty of funding available for those industries. If you're not, there's still plenty of funding available for other industries as well. There's a total of $100 million set aside for these grants right now. So please just make sure you get in and claim yours. It's relevant to this healthcare discussion again, because if you're facing these expenses and it's a challenge for your business, or you're wondering how you're going to pay them, you want to make sure to take advantage of these other things that may help to abate some of those other large expenses that are built into your business model. So head on over delbiz.com/relief. If you haven't checked it out yet, you can access the portal today. It is live. You can apply for funding. You should know your decision on funding in a couple of weeks. And I'm going to turn it over to Nick.
Thanks, Damien. Nick?
Yeah, thank you, Damien. I know that it's going to help so many small businesses throughout the state. So just a wonderful, wonderful effort. So yeah, I wanted to talk a little bit about some healthcare specific decisions that many businesses of all sizes, and in particular that small businesses are facing. You could advance the next slide for me there. Thank you. So first, I wanted to touch on, what are some things that have happened during the state of the public health emergency here. And you may be familiar, but in case you're not, there were quite a few mandates that came out through as part of the public health emergency. And some of the things we've taken and extended as well through Highmark, but just to highlight some of them. Testing. Testing comes up as a question fairly regularly from our members and our communities that we serve. And anytime that testing is prescribed by a medical professional, one of the mandates is that these things are covered 100%. So in terms of financial barriers, co-pays, co-insurance, deductibles, those things are waived when a test is prescribed by a medical professional. And then if folks do have COVID and they need treatment and they need to go into the hospital as an example, same thing. Those financial barriers are removed to try and make sure that folks access the care that they need when they need it. Now, for folks who may have some concerns about safely being able to access care and being out and about in the community, boy, has this this pandemic highlighted the need for virtual healthcare delivery and telehealth and telemedicine in particular. I'll share that in our books of business that we serve throughout Delaware, Pennsylvania, West Virginia, and our national customers at Highmark. Over the first couple of months of the pandemic, we saw an uptick in telehealth utilization that was unsurpassed, unprecedented. If you take the last several years at it together, what we saw in those first couple of months outpaced that. And one of the things that our physician community has asked here in Delaware is, well, is that care all being accessed remotely, meaning a doctor in another state or a vendor that offers telehealth services? And there are some instances of that. However, the overwhelming majority has been offered by local physicians here in our state and caregivers in our state who have adopted and put into use these telehealth services. So same things when there were televisits related to COVID, that those cost sharing and co-payment barriers were removed. And these waivers continue clear through the end of the year. And we continue to monitor it and make changes. That date has been a shifting date. Originally, it was going to end at the end of September, so yesterday. But it got extended through the end of the year. And we just want to do, as an industry, what we can to try and make sure that folks can access the care they need when they need it. And I also want to highlight wellness, that folks aren't ignoring, staying on top of their regular routine care. And virtual visits and telehealth visits offer a real opportunity to safely do a lot of the routine care. In particular, folks who are in need of behavioral health. We've witnessed such a large uptake in behavioral health visits happening virtually. And so that's been really good to see. And I think something that'll be here for the long term, even beyond the pandemic. And in a way that, thinking of it as an employer offering benefits to employees, ways to wrap in telemedicine and telehealth in particular. If you could jump to the next slide for me, please. Thank you. So, one of the things that, and I don't want to sound like a commercial for Highmark. So these are some things that we've done, but our competitors have done some of these things too. And it's really just, how can we get employers, how can we do our part to help employers safely go back to work? So I know many of you have struggled to keep your businesses open and thriving. And how do you safely bring back your workforce? And there's a lot of things that you need to do and consider doing. And so there's all kinds of toolkits available out there, not just the ones that we supply, but we're happy to do that for you if you need it. Thinking about signage you can put up at work. If you work in a building that has a high rise and elevator safety and restroom sanitation and hand sanitizing sanitations and signage about keeping as socially distanced as possible. But I think if I were to kind of take the number one takeaway for me from this is if you are able to have your staff and your teams work remotely without a major interruption into the business, and that's still ultimately the safest thing to do. And we would encourage that if your business is enabled in that way. You can jump to the next slide for me, please. So thinking specifically about your cost and healthcare, health insurance, I just wanted to give a big overview of like, what are the general levers that you can pull as an employer on behalf of your teams. And so thinking about the spectrum of insurance, on one far extreme, there's fully insured programs. These are programs where you're paying an insurance company like Highmark or Aetna or Cigna or United Healthcare. You're paying an insurance premium and you're buying insurance coverage. And the insurance company is paying the medical bills beyond whatever deductibles or co-payments that you might have. On the other end of the spectrum is self-funded programs. Very large employers, this is kind of the norm in that space. So thinking of employers like the state of Delaware themselves, they self-fund, meaning they pay an administrator to process claims, have access to a network of medical providers, administer co-payments, deductibles, co-insurance. But in reality, it's the employer paying those medical bills. And many small employers, this is a very risky way to go in terms of if you're fully self-funding, because one bad claim can happen and can kind of totally wipe out a business that does not have an enormous amount of cash on hand, cash capital or reserves. And then in between those two extremes, there's something called level funded. And level funded tries to blend some of the aspects of both of those things. So there's insurance protection. Think of it in terms of almost like a large deductible, where you as an employer say, I can handle up to X, but beyond X, I need help. And so it has some of those aspects that large employers enjoy about self-funding in terms of the design of the plan. And then there's the basic designs that I won't go into big detail here because my assumption is that many folks tuned in today probably are aware of deductibles and co-insurance, that percentage that you would share where the insurance company is paying a portion and you're paying a portion. But I do want to talk a little bit about specialty networks. There are networks out there that administrators can put into play for you, whether it's vendors or TPAs or an insurer like us, where you say, I need a really highly specialized program for diabetes or for musculoskeletal surgeries, things like that. There's ways that you can ensure that your employees and their family members have access to the highest level of care at the, we like to refer to it as the right time, right place, right cost. And then integrated pharmacy for those who do have those self-funded programs. When you have your pharmacy benefits integrated with your medical benefits, there's a lot of care management that can happen from your administrator where they can observe things like medication interactions and best practices that kind of both manage cost, but also ensure quality and improve access. If you can go to the last slide for me. And then just some examples specifically for small employers in Delaware that I wanted to highlight. And this is a little bit within our Highmark family. We have quite a few programs to choose from. I mentioned that level funded option. This is new for us to be able to offer to small employers. We call it balanced funding, but we have that type of product. And the good news for 2021, our pricing for small employers is going down by 3%. This is the first time of a decrease in many years. And then for those of you who may be sole proprietors or self-employed, purchasing health coverage on your own, in the individual market, the pricing's going down for the second year in a row. We worked collaboratively with the Department of Insurance here in the state and the Department of Health and Social Services last year to establish a reinsurance pool that really helped to stabilize the rates. For those of you who purchased those plans, coming into 2020, the rates went down 19%, and going into 2021, they're going to go down another just under 1%. So reductions in back-to-back years. So some good news in terms of those markets really becoming stable. And that's what I really wanted to share today. I thought it's also helpful. I'm thankful Lou has joined us to give the perspective of a broker and a consultant today. So I'd like to turn over to Lou.
Thank you, Nick. I appreciate that. And Mike, thanks for inviting us to be on the call today. It's a privilege for us to be a part of this team here with Damien and Nick. It's a privilege for Weiner to participate. And on the next slide, I just wanted to talk to you about the perspective of the role of your advisor, your consultant broker. While health insurance is a big part and the largest part of the cost of your benefit program, and there are many levers within that program by itself, there are also, we tend to take, or your advisor should take, a holistic approach to your entire benefits program, and even some connected components where cost savings can be realized, and look at the entire package as possibilities for savings and efficiencies. And of course, looking at all of this should be consistent with your goals and your culture and what you're trying to accomplish, and of course your budget as well. So one of the things, the most important things, is benchmarking, going out to the market, looking at all the available options. There are many options out there. There are many plan designs. There are lots of various vendors that provide different services at different costs. And maybe the combination of your products and services you've designed in your benefits for your employees maybe needs some efficiencies, hadn't been looked at in a while, maybe from a market perspective where you're trying to attract and retain folks, that maybe there's some sharpening that can be done. Analyzing what's available is a big part of that, and you can often find some efficiencies in there that can save the company and the employees some real dollars. And then look, as Nick alluded to, there are alternative plan funding concepts to consider, fully insured, level funded, self-insured, and I'm going to talk about that in a second a little more. But often we don't look at things like technology and integrating services. So what we're finding more and more as employers, in order to save time and money and administrative costs, maybe trying to work around a smaller staff, consolidating technology, for instance, an employee benefits or human resource management system that integrates with payroll and integrates with your retirement plan, that can provide a consolidated service model where there's a more direct, easier access to all of what's required. Often we can save a lot of time and money just in trying to find ways to connect all of these components. So that is something that should be looked at as part of a holistic package of your benefits. And of course, the consolidated service model, calling one number for all of your services and having one team to work with all of your components can alleviate some time and frustration and reduce costs. Certainly improving communication and the use of resources that are available. Nick provided some examples of what Highmark provides as resources. And part of the process that an advisor or consultant should bring to an employer group is understanding of all those communication resources that are available. And because there's some great value-added free resources that all of your vendors, your medical, dental, life, disability, retirement plan vendors provide that can bring a ton of value to your employees and help them feel like they're getting more out of their benefits programs. So a consultant should be finding those resources with all of the vendors and then making sure that they're communicated, because a lot of the great programs and value-added like wellness programs that a Highmark provides as part of their programs, some employers and their employees don't even really know about. So communicating those is huge, and then implementing them. If you have these wellness programs, implementation is a big part of it. It's time now to start looking at those things, because you may be able to bend the trend, so to speak, by implementing some proactive approaches. And especially if you're using some form of self-funding, like a level funded program, where you can actually get some return on the investment into wellness programs that actually reduce your costs for your health insurance in real time in future years. So it's important to ferret out all those opportunities and implement them, but also the use of advocacy and support programs. Nick mentioned the fact that behavioral health is, and it's not surprising, and I don't believe we're only starting to see the tip of the tsunami that is connected with that, in the sense that everyone being at home the last 6 months, I think there's a lot of behavioral health activity that will probably manifest in medical claims and concerns in the coming year or two. So it's important to get those programs out there and communicated and implemented, so that the employees can have access to the help they need when they need it, and reduce stress and hopefully the long-term health effects of the stress of these current times. Also, voluntary products. Some employers, many employer groups are looking at ways to shift certain benefits out, or sort of put the mortar between the bricks by offering various voluntary benefits that kind of fill in the gaps. And then outsourcing HR services, administrative services, liability through your property and casualty carrier, looking at all of these things holistically with your partner vendors can bring a more consistent, lower cost effective approach. And then of course, exploring other coverage opportunities. So on the next slide, I just wanted to unpack a little bit what Nick was referring to. When we benchmark and we look at other opportunities in the marketplace, we're also looking for alternative funding concepts and if they make sense for your group. So you're all familiar mostly with the fully insured concept, and I won't belabor that. A defined contribution, it's not in the sense of your retirement plan, but in the sense of your benefits, where an employer budgets dollars and then spread those dollars out, and then so the defined contribution from the employer is the dollar expenditure out of the budget towards benefits. Challenge with that is the benefits might cost more than the budgeted amount, so it might help the employer save money, but the employee picks up the cost. Using and exploring the use of funding accounts, additional funding accounts like health savings, flexible spending, and health reimbursement are ways that the employer can provide dollars, first dollar benefits to cover out-of-pocket expenses for employees. When you look, and I imagine Nick can attest to this as well, is when you sample a group of 100, probably 75, maybe to 80, 85 have claims under $1,500 or so. And the majority of those have claims under $500. So if you thought in terms of funding with funding accounts like health savings accounts or flex spending, those first dollar out-of-pocket amounts, you might be able to satisfy the majority of your groups. The claim drivers are usually the top, there's usually 2 or 3 out of 100, but the top 10 or 20% are where all the claim dollars come from. So you can really capture the majority of your folks by using first dollar accounts like health savings accounts and HRAs. And as Nick mentioned, level funding plans are becoming more and more popular because they kind of combine some aspects. The structure of a level funded plan and that premium is that a portion of your monthly costs go towards the fixed cost of the plan, and the portion goes into a claims bucket. And at the end of the year, the idea is if there's any money left in the claims bucket, you get some of that back. And so there's an incentive for wellness and health in a level funded plan with a cap on the risk. And that's what employers moving from fully insured that are looking for cost savings, level funding could be a great idea for them. So we explore that. A consultant and broker should explore that as an option. And it's great that Highmark has options there as well. As Nick mentioned, limited self-funding is the other self-extreme. And notice I added the word limited versus self-funding, because in a self-funded plan, you have reinsurance that capture risk. So a properly designed self-funded plan has risk mitigation through reinsurance on an individual level and on a group level that limits the risk of the group. So yes, you might have cash flow concerns month to month, but the total aggregate risk for the year shouldn't exceed what the typical cost of a fully insured plan is. If it does, or if it is, then maybe fully insured is where you should be, not limited self-funding. A consortium and captive kind of pools groups into a selective pool and shares the risk and spreads the cost with buying power. With consortiums, you need at least 50 employees or in your group to be a part of a consortium. Captives, you can go down to 25 with some captives, but really it's 50 or more. And limited self-funded, it's usually 50 employees, or sometimes you can get down to 25 there. The good thing about level funded is you can go down to 5 employees or less, and that is a good step in that direction. Consortiums, captives, limited self-funding are definitely not for everybody, and it depends on the size of your group. But if a consultant is looking at all the levers to pull and all the options in the marketplace, then these should and would be a part of the conversation. So on the next slide, looking at other coverage opportunities, your consultant should look at your group and see if there's opportunities for Medicare eligible folks to there can be education provided to see if Medicare options make sense for them. And if you were to see if Medicare eligible folks in your group were better served on Medicare and a supplement and a Part D, that potentially could save the company and the individuals a great deal of money. So looking at those and then having somebody to come in as a third party to present educational opportunities, because as you know, you can't coerce anybody to get off your plan. But also looking at individual marketplace and individual coverage and marketplace opportunities, and retiree coverage concepts. And the last point, the group retirement plan should be part of the holistic view, because in the end, it's about the holistic view of an employee feeling like they have a secure sense of well-being. So the health insurance, life insurance, disability insurance, a retirement plan all contribute to a sense of well-being, and they all are levers. So even in your retirement plan, there are components where the employee and the group could save money. And then also for individuals, if you're looking outside of your group plan and group coverage. On the next slide, we also look at, as I mentioned, voluntary benefits. The mortar between the bricks, so to speak, but you have to design a proper plan and communicate it properly, and have one of the biggest headaches of voluntary plans is administering payroll deductions. So you would want to have a program designed and the proper education to eliminate the to pull it off your desk and put it on somebody else's desk and make sure it's communicated properly. And then on the next slide, Nick alluded to this as well, as the advocacy and support. A good employee assistance program is crucial, and often they're value added, included with health plans or disability plans. So the important aspect is to make sure we know that that's in your plan and it's communicated to the employees and they know how to access it, especially in these times. So they're not expensive. They can be as simple or as comprehensive as you like, and it should be something that's explored as part of a holistic view of your entire benefits package to bring security, safety, and well-being to your employees. So on the next slide, that's all I have. So thank you. I guess at this point, Mike, if you want to take over.
I do. Thank you, Louis. Thank you very much. Thanks, Nick. Thanks, Damien. Damien, we're going to run first to you. I'll give you a second because I think I know Kelly typed that contact phone number for help into the chat box. But if you could repeat that phone number in just a second, that would be great. But the question I have for you is, hospitality sector, and you alluded to this, was hit especially hard. I don't know if any of the statistics you have from the first round suggest kind of how resources were used, and if so, in what way. And then I know that in the chat box somebody had asked, kind of what's the status of this round, and how far do you think the funding will extend, and then would there be a third round? So a couple things, if you could take a second or two to address a couple of those comments or thoughts.
Yeah, sure, Mike, no problem. So, I mean, the first thing I'll say is just we look at job losses to try to figure out, how badly a sector's been hit. And I think through, January to May, which was the most severe portion of the pandemic containment efforts being, mid-March to late May, 33% of the job losses in Delaware were in the hospitality sector, and the vast majority of those in the restaurants. So 33% of the total job losses in Delaware were in those sectors. If you look a little bit beyond that, 80% of our job losses, or about 3/4 of our job losses, came from four sectors. That was healthcare, retail, hospitality, and cosmetology. And so for our grants, that really makes up our disproportionately impacted industries. There's a few others in there. And in healthcare, it was a bit of a mixed bag because there's some, dental offices saw severe job losses. Hospitals didn't see as severe. So we did decouple that a bit. But we really wanted to focus our resources, particularly in that first round, towards that group. There's a few features of the grant that make it a little bit easier for them to apply and get the money a little bit more rapidly. About 80% of our funding in that first round awards, the $25 million of awarded grants, went to those disproportionately impacted industries. About 30% alone went to restaurants. So we wanted to make sure we hit those. Hopefully they'll continue to come forward. We know the need is great there. And many of them, unfortunately, meet the key requirement for the program, which is open to all businesses. But you have to show a 7.5% revenue decline. And I think many of the folks in those industries have no problem showing that, to their detriment, but at least makes them easier for them to get the funding. And then just a quick update on this round. So I've been tracking it as we've been on, because we track it in real time. We went from, when I got on this webinar, we had about 650 applications in. And as of just a couple minutes ago, we have now over 700. So we're definitely getting a lot of applications this round, which is what we like to see. We'll kind of do an analysis in the coming days of, how many of those are coming from those disproportionately impacted industries and such. But it's clear that the demand is there. If you haven't had a chance to apply in this round, we're going to have the The application window is going to be open at least through the end of the weekend. We'd like to keep it open through next week, so don't panic and think you have to sign off this webinar and go apply now. You'll have an opportunity to do so because we want to make sure that folks have a chance to get their applications in.
Great, thanks, Damien. Nick, let me ask you, you mentioned telemedicine, and I know that it's something that I've taken personal advantage of. It's really, really a great tool. Do you think those kinds of efficiencies, recognizing that adoption of this has all been pretty substantial, as you point out, more recently, do you think at some point that will result in any cost savings for businesses that offer healthcare benefits to their employees? Do you think there's any kinds of savings? There's clearly the efficiencies that come to me as an individual in terms of not having to go take a drive to visit my physician. But at the end of the day, do you think that there's some kind of net benefit in here for employers and their employees?
It's interesting, Mike. There's a theory that there will be actually a short-term increase in cost with a long-term savings. And let me explain. There may be folks who weren't accessing care pre-pandemic, who for whatever reason it wasn't convenient. Maybe there was transportation issues, access issues, or just an unwillingness to physically go to a healthcare provider. And hours, several different barriers. And maybe those barriers are now removed through telehealth and virtual visits. So folks who weren't seeking care before would possibly seek care now. So small increase in cost for a visit that didn't exist in the pre-pandemic. But healthcare items that could be caught during those visits and care recommended, again, short-term increase in cost, but catching items before they become kind of that ticking time bomb, so to speak, and catching items before they become big items. And so I think there is some long-term savings there. And I think, so much of what I tend to focus on is the experience of the person, right? Going through a healthcare system, interacting with clinicians and caregivers, and interacting with their benefits provider. Our industry is not terribly integrated at the moment, right? So it leaves a really disjointed experience for a person. And I think anything we can do that helps get to a better experience at the end of the day, and I think telehealth is just another tool in the toolbox to get there, is helpful. So I do think it's here to stay. I do think there's some long-term savings, some short-term potential increase in cost, but also some immediate experience improvement.
Great, thanks, Nick. That's helpful. Louis, to you next. What's your experience? You had mentioned, Nick alluded to this too, but HSAs, flexible spending accounts, other options. How many employers actually take advantage of that? And is it a very high percentage, and they actually make those options available to their employees? Or is the experience kind of uneven? And what's the case for offering those options? I can just tell you personally, I wish that I had started funding my HSA a long time ago. I don't think I quite understood what a great deal it really is. But anyway, can you address some of those options and kind of what the experience in the market is?
Sure. It's we've kind of seen it cycle through, because originally you could have come in with a high deductible health plan and fund a health savings account, for instance, and save money, just in the total dollars expended. And then as health insurance costs went up, you saw employers use less health savings account dollars and start switching to health reimbursement. Whereas, just to be clear, health savings account dollars can be funded by an employee or an employer, and those dollars become the employees. Whereas a health reimbursement is a pay-as-you-go by the employer. It's a promise to pay, and dollars are only expended when they're needed. So it tends to be philosophical from an employer perspective on, do they want to give employees money to run their own health plan, health decisions, pay for their own health decisions through a health savings account and let them accumulate money over time? Or do we want to fund pay-as-you-go to alleviate the access and only expend those dollars as needed through a health reimbursement? So we've seen those ebb and flow depending on the marketplace and the cost of insurance. And we've even overlapped them in some cases to provide layers of benefits. But as in the current environment, looking at looking at things as a more of a holistic view from a financial wellness perspective, the health savings account is being encouraged now as a vehicle, not only just for today's medical expenses, but for your future medical expenses. So just like you contribute to your retirement plan with tax-free dollars for your retirement, you should also look at your health savings account as a tax-free vehicle to accumulate medical dollars for your retirement years too. So starting to change that concept or the view from a day-to-day meet the medical needs view to a long-term perspective. Even some of the banks that are being tied in with the high deductible health plan, like at Highmark, the bank allows you after a certain balance minimum to invest that money into mutual funds. So then it becomes more of a long-term vehicle to use health savings account dollars that can be spent tax-free on medical expenses, not just today, but 30, 40, 50 years from now too. So as employers are starting to look at that from a more holistic view, and it's being communicated as a single thought process, you're seeing the resurgence and the a broader view of health savings accounts, even to the point where now your retirement plans are showing you your HSA component alongside your retirement balance on one portal. So it's starting to create that view of, wow, this should be looked at as one thing. But fundamentally what it does is it gives the individual the choice to use those dollars however you see fit. And that, I think, is huge, because the marketplace can determine where they go. I think the missing component is transparency. If we knew exactly what it costs to go to certain providers for certain services, then that would help that process quite a bit. But it's not totally transparent at this point.
Lou. And actually, yeah, that's where I was alluding to. I mean, as all of us get older, the statistics suggest you're going to use more healthcare in your 6th, 7th, 8th, hopefully 9th decades of life, maybe longer. So stacking money away into an HSA is a very, very smart part of a longer plan. Damien, back to you for a second. When you look back at round one, and I think maybe you addressed this in part, was the experience, do you think that most people that were in round one, did they apply the money toward rent, or what would, and I don't know if you have statistics on this, but did you see certain patterns develop where the money was put to use in ways that were the most, if obviously employers are going to make different decisions, but did you see any trends? And I think maybe you had a slide that kind of talked a little bit about this, but can you talk a little bit more about that? Where is the money actually being used? Obviously you had the federal payroll protection program, which was, as the name suggests, payroll related, but how about the grant program that you've been managing?
Yeah, Mike, I think the vast majority we see is going towards rent and those other fixed expenses that those disproportionately impacted businesses are eligible to claim. Rent, insurance, the business insurance, liability insurance, and utilities. But then we're seeing some other stuff that's interesting. I mean, I think what we're seeing is, which we were hoping the program would be helpful for, is restaurants applying to buy equipment for outdoor dining. We saw a few restaurants, I'm hoping some more in these subsequent rounds, NFA business, other businesses, start purchasing equipment, tenting equipment to enclose an outdoor dining space with the cold months coming. That's completely eligible. So nice to see people who are utilizing the grants to sort of adapt their business models a bit. What we didn't see as much of, which I wasn't sure, we wanted to make it eligible, but I wasn't sure how much we'd seen, is people drawing on money so that they could build website enhancements, things like that. Some of it was already done, but we didn't know, in talking to people, they said, my website's not where it needs to be to reach customers, or I'd love to have a mobile application. I have a theory about why we didn't see so much for mobile applications, but we didn't see a lot for websites either, new websites. So either people have them or there's just other expenses they really want to cover with the funding. So that was interesting. And then refinancing debt. We saw a lot of people try to refinance an EIDL loan, which is great too. Get themselves out from under that payment going forward, or at least a portion of that payment going forward.
Gotcha. Thank you. That's helpful. Thanks.
Yeah.
Nick, back to you for a minute. Survey after survey, when we ask chamber members what are some of their top issues, number one on the list always is healthcare costs. Association plans were part of the discussion back during passage of the Affordable Care Act, otherwise known as sometimes Obamacare. And it's our position, we would never advocate for a skinny plan or something that's not meaningful. It has to have essential health benefits. It has to be meaningful. What options are out there under current law and policy that you or others have? And Louis, I'll ask you to jump in on this too. We only have a few minutes, so we have to go to closing comments in a few minutes, but let's address this one. Nick first, then Louis, and then we'll come back to Damien, and then we'll go through the round for everybody for closing comments. But Nick?
So I think what might be most helpful, Mike, is if I kind of shared for the audience and the folks tuned in of just kind of association health plans in general, right? So certainly, more choice is a good thing, right? The more options of folks have, the better. The challenge that we face, kind of specific to Delaware and around the concept of association health plans, is we're a small state, right? So we have a finite number of folks to be in a risk pool. And the concept of insurance, whether we're talking about those level funded programs we mentioned earlier or fully insured plans, is pulling folks together. And thinking of small businesses in particular, the way our small business fully insured plans work today is all of the small businesses around the state who participate with the fully insured plans, their risk is pooled together. And so when we set the pricing year over year, the pricing is a function of the overall claims experience of all of those small businesses rolled up together. And moving into 21, that was the good news. The experience has been relatively good. The rates are going down 3%. If there was, let's say, a robust association-based program, side by side the current fully insured population, if the benefits were identical, theoretically the pricing would also be identical. Or what could happen is, if the pricing was better, it could draw some folks out of that fully insured pool into this, I'll call it a new pool for lack of a better descriptor. And they're either going to have better experience or worse experience than that existing pool, or be younger or older in terms of average age. And so one of the two ends up going kind of in this death spiral of increases, and the other one gets really good. And so we might end up causing an imbalance in what's already a kind of a small population. If you add up small businesses around the state right now, in terms of these fully insured plans, it's about 25,000 people, 25,000 Delawareans that are enrolled in those kind of plans. And if you think about the individual market, that's roughly the same number, 26, 27,000 folks. So even bringing those two populations together you're kind of looking at a max universe of 50,000 people. And if we pulled in some folks who currently walk around without insurance, it's still not that large of a population. And so spikes in claims or adverse selection in either direction away from one of those pools creates a challenge. And so that's been our biggest barrier. In terms of Highmark, we have these type of plans kind of on the shelf, so to speak, ready to go. We just haven't brought them here because we didn't want to cause that disruption to the markets that have in large part stabilized over the last couple of years.
Perfect. Thanks. Louis, and we're going to have to be quick here. Louis, any thoughts on this topic?
No, I would have echoed everything that Nick said. As a consultant, you want another option to show the employer groups, and you want it to be a viable option. So that option has to have the benefits, as you said, Mike, but it also has to be able to pay the claims. So one of the other challenges in these association pools is the reserve and the ability to be able to pay the claims, and then also to be stabilized by handling the top end risk. The only thing that made, for instance, the Affordable Care Act and the exchanges viable was the subsidies, government subsidies through contributions from the federal government. So that leveled off the risk on the top end. Your association plan wouldn't necessarily have that. And I don't know how you would create that mechanism to shave off the top end of the risk. But it's exactly as Nick said, the risk, the pool is, the rates of the plan are going to reflect the risk in the pool, and that is determined by the members in the pool and how that works. When you look at captives and consortiums, they're very selective about letting groups into those pools, and even some carriers level funded plans. So filtering of the pool is the way to keep it stable enough, but then you're excluding a whole bunch of people, which is counterintuitive to what you were probably or what the association members might want, right? They want to be able to get in and get access to affordable healthcare, and that's just a huge challenge when you talk about all that risk, like Nick mentioned. So,
thank you. Thanks. Well, let me thank all of you. We've got about 2 more minutes here, and so I'll ask each of you to take maybe 15 to 30 seconds and just kind of offer any closing comments or thoughts. Damien, let's start with you.
Yeah, no, thank you for having me. Hope folks got good information about the opportunities available to you. You know, this fits together, I think, nicely because if you're looking at a suite of costs, it's all the same money that's got to cover those costs. So if you get funding from our program to cover some of your other costs, hopefully it frees up resources so you can cover your healthcare costs and still generate the return that you're expecting. So application portal's open now, and if you haven't already, I encourage you to look at applying.
Okay, and Damien, what was that phone number one more time?
Phone number was 302-672-6816.
Terrific. Thanks very much, and appreciate you taking time out on a very busy day. Nick, your final thoughts and closing.
Yeah. I want to thank the chamber, thank the audience for tuning in. Mike, Damien, Lou, it was great to present alongside of you. Happy to help. If there's anything that we can do, feel free to reach out to our teams directly. We also just want to mention we have the Blueprints for the Community, our foundation. So if any of the small businesses also happen to be nonprofits, we have some grant making available to help. And so feel free to reach out to our teams at Highmark and also through the Delaware Community Foundation to find out more.
That's terrific. Nick, thanks very much. Louis.
Mike, thank you. Thank you to your team, Helena, Kelly, the chamber team, Nick, Damien. It was a privilege for us to be a part of this, and we're here to help. We want you to have value, so please let us just do whatever we can to assist you. Thank you. Appreciate the time.
Right. Well, let me thank all of you, the folks who tuned in, and our panelists here today. Again, we've got some really terrific programs coming up here in the next couple of weeks. October 14th, Developing Delaware. our government affairs conference later in the month of October. We will have a webinar at the end of the month with a representative from the U.S. Chamber of Commerce who's going to present national polling data about 6 days before Election Day. I think that'll be very interesting. Figures from some key battleground states, both for control of the U.S. Senate and, of course, in the presidential race. So a lot of great things, and superstars in business in early November. So lots going on. Check it all out at dscc.com. I'm Mike Quaranta. I'm the president of the State Chamber. Thanks very much for tuning in. And again, thanks to all our panelists for joining us here today. Thanks, everybody.